Hi, my name is Thuy Vo, and I'm going to be talking about a class of medications called SGLT-2, also known as sodium glucose cotransporter-2 inhibitors. So to start off, we have patient consultation. You should take this medication in the morning. This medication can cause increased urination and dehydration, which can result in dizziness, lightheadedness, weakness, fainting, and thirst. This medication can also cause a rare but serious condition called ketoacidosis, so make sure to let your doctor know if you develop nausea, vomiting, or feeling tired or stomach pain. So, infection of the urinary tract can occur while taking this medication, so let your doctor know if you have any burning or pain when you urinate, a need to urinate frequently and urgency, or if you have pain in the lower part of your stomach or blood in your urine, especially if you have a fever. And another serious but rare condition is that the medication can increase your risk of leg and foot amputations. So, to introduce the SGLT2 inhibitors, they are an oral diabetes medication class. They have desirable side effects for type 2 diabetes patients, such as weight loss and reduction in major cardiovascular events and mortality. There are four main medications: the canagliflozin, Invokana, dapagliflozin, Farxiga, empagliflozin, Jardiance, and ertugliflozin, Stiglatro. The indication is for type 2 diabetes patients as an adjunct to diet and exercise to improve glycemic control, and also a risk reduction of cardiovascular mortality in adults with type 2 diabetes and established cardiovascular disease. And also, this class of medication decreases A1C from 0.7 to 1%. So, in terms of dosing and adjustments, these medications are dosed based off eGFR. So, the Invokana is 100 milligrams daily prior to first meal of the day. It can be increased to 300 milligrams daily. If the patient has eGFR between 45 to 59, max dose is 100 milligram. And if it's less than 45, they're not recommended to take the medication. For the Farxiga, 5 milligram daily in the morning, they can increase to 10 milligram daily. And if their eGFR is less than 60, it's not recommended. Jardiance, 10 milligrams daily in the morning, they can increase to 25 milligram daily. And if eGFR is less than 45, then it's not recommended. As for the Stiglatro, 5 milligram daily in the morning, and then if eGFR is less than 60, then it's not recommended. So the mechanism of action is that the SGLT2 inhibitors are expressed in the proximal renal tubules. They're responsible for reabsorption of filtered glucose from the tubular lumen. They inhibit SGLT2. These drugs can reduce reabsorption of filtered glucose and lower renal threshold for glucose. This increases urinary glucose excretion and decreases plasma glucose concentrations. For the side effects of these medications, there is a black box warning of risks of leg and foot amputations, so we need to evaluate the risks prior to treatment. So if the patient has a history of amputation, a peripheral artery disease, peripheral neuropathy, and or diabetic foot ulcers. There's going to be weight loss for the patient, hypoglycemia, increased urination, increase in thirst, and increase in magnesium, phosphate, and potassium. Monitoring parameters include renal function, blood glucose, A1C, LDL, blood pressure, and volume status.